Hello class, and welcome back to Business 80, Medical Terminology and Anatomy. Today we're going to be doing Chapter 14, the Blood and Lymphatic System. So let's get right into it. So the structure and the function of the circulatory system, or the blood and lymph system, is to pump blood through vessels. I think that's pretty much what everybody knows, right? Its liquid portion is called plasma, and plasma is oftentimes, plasma is required for a lot of the blood tests that we do. So if you become a lab tech or a phlebotomist, you'll become really familiar with knowing the difference between plasma and serum when it comes to certain blood tests and what is required in order to do testing. And I think we'll talk about that a little bit more as we go. Lymphatic fluid moves through the lymph channels, okay, and it moves through the vein or through the veins, through the lymphatic and the thoracic ducts, okay. So both fluids have high water content. As a matter of fact, the human body is made up of roughly about 90% water, okay, but they differentiate in the way they distribute certain things like fats and proteins, okay. Some of the shared functions of blood in the lymphatic system, okay, to collect and transport certain substances, minerals and such, to protect and heal the body by strengthening the immune system, okay, and then there's some specialized cells that kind of originate in the bone marrow, okay. All right, so let's see. Hematopoiesis, great medical term. It means blood formation. Okay, hematopoiesis. The different types of cells in the blood: erythrocytes, leukocytes. Erythrocytes are the red blood cells, or RBCs. Okay, so erythro is pertaining to red. Leuko, L-E-U-K-O, or leuc, is referring to white. So erythrocytes are red blood cells, or RBCs. Leukocytes are white blood cells, or WBCs. Okay, so the red blood cells, they transport oxygen and carbon dioxide, and then the white blood cells are active in our immune system response. Okay, and then there's some breakdowns of the leukocytes, the granular and non-granular, and then thrombocytes. Thrombocytes circulate through the blood, and thrombo is referring to a clot. So thrombocytes aid in the clotting process. Okay. Let's see. Immunity. Stem cells in the bone marrow produce lymphocytes, okay, which are white blood cells, and phagocytes. Lymphocytes are found throughout lymph tissue, especially in the spleen and the lymph nodes, and those aid in our immune response. B cells mature in bone marrow, and then T cells mature in the thymus, and these are both cells that are highly involved in the immune process. Okay, and then phagocytes, those are cells that kind of engulf or swallow up and digest different microorganisms. So again, that's all aiding our immune system. Okay, organs and tissues of the circulatory system, or the blood and lymphatic system. Okay, bone marrow, erythropoietin, which is a hormone that's produced by the kidneys. It stimulates the bone marrow and helps to produce red blood cells. Okay, the lymphatic system. Okay, lymph nodes, lymph tissue located along the lymphatic channels. They release lymphocytes, okay, which are the primary cells of the immune system. Okay, it talks about the location of lymph nodes: axillary, under the armpits, inguinal in the groin area, cervical lymph nodes in the neck, popliteal behind the knee, and then submandibular, the floor of the mouth and the lower jaw. Okay, lymphatic tissue. Very transparent. It's kind of a slightly yellow tinge to it, or yellow appearance. Okay. And then phagocytosis, I love that term, is the process of destroying different microorganisms, and particularly harmful microorganisms. Okay, lymphatic vessels, let's see. Let's talk about the spleen, okay, the largest structure of the lymphatic system. Okay, it initiates the immune response. It filters and removes bacteria from circulation. So if anybody's ever had a splenectomy, because the spleen initiates the immune system response, without the spleen, our body systems are subject to having different bacterial and viral infections without a lot of great protection. So somebody who's had a splenectomy or their spleen removed usually is going to be required to have to take many immunizations throughout their lifetime. In particular, immunizations that they normally wouldn't get it as an adult, that we've given to them as a child. They would have to take those as well as when they're an adult if they don't have a spleen. So I always find that one to be a little bit interesting. Okay. Immunity, probably the things that I would talk about here is the 5 major classes of immunoglobulins. Okay. So immunity is the body's capacity to resist or fight off invading microorganisms or other toxins. Okay, so the 5 major classes of immunoglobulins. IgG is 80% of the plasma antibodies. IgM, first immunoglobulin produced and located mainly in the vascular system. IgA defends against pathogens on body surfaces, especially the respiratory and GI tracts. IgD, present in plasma, in particular on the surface of B cells. And then IgE, involved in immediate hypersensitivity or allergic reactions. So probably the way that I would remember this is looking at 2 of these in particular. IgE as an acute response, an immunoglobulin response, or a immune system response to something that's happening right now, like an allergic reaction. And then, okay, IgG is the long-term immunity or long-term immunoglobulin. So this is produced by things like vaccinations. All right. Let's see. Cell-mediated immunity. T cells respond directly to antigens and destroy target cells through secretion of lymphokines. Let's see, cell-mediated immunity. T cells respond directly to an antigen, so being introduced to an antigen. And it says one example is an organ rejection, meaning that if we were doing some type of organ transplantation, typically, because it's not your organ, you're receiving it from somebody else, the body will recognize it as foreign and will want to reject it. Okay. Acquired immunity, long-term immunity to specific antigens. Okay, so acquired immunity, long-term immunity. Okay, and there's different types. There's natural active immunity. Okay, so the immune system responding to a harmful agent develops long-term immunity. So something along the lines of maybe chickenpox, for example. We see herpes zoster, which is the virus that creates chickenpox, and as a natural active immunity, we've caught it, we've identified it, the body has identified it, and then the body builds up some long-term immunity to contracting it again. Doesn't mean that you can't necessarily get chickenpox again, but in most cases, if you've had chickenpox in the past, you will not develop chickenpox in the future. However, you are now susceptible to shingles as an adult, which is a reactivation of the herpes zoster virus. Natural passive immunity, transfer of antibodies from mother to fetus or through breastfeeding, okay, which it says it confers temporary or partial immunity, short-term immunity. Artificial active immunity obtained through vaccination with weakened or dead infectious agents. So things like your flu vaccine, your hepatitis B, varicella, your varicella zoster, MMR. And then artificial passive immunity provided by substances that give immediate but temporary immunity, such as antibiotics, gamma globulin, interferon. So that's a short-term immunity, artificial passive. Okay, some physical exam terms. Angioedema, subcutaneous and dermal eruption with diffuse swelling of the subcutaneous tissue. Subcutaneous tissue is fat tissue. Okay, a butterfly rash is a classic sign of lupus. Butterfly rash kind of looks like butterfly wings, typically on the cheeks. Chills, cyanosis, that blue discoloration. Ecchymosis is bruising, a fancy term for bruising. Embolus is a mass that travels through the bloodstream and is capable of blocking a vessel, which would be a blood clot. Epistaxis, nosebleed. Hematemesis, vomiting blood. And hematochezia is passing blood through stools. Hemoptysis, bleeding from the lungs. Hemorrhage, uncontrolled bleeding. Lymphadenopathy is an enlargement of the lymph nodes. Pruritus is itching. Splenomegaly, megaly being enlargement. We've had that term before, so enlargement of the spleen. Okay. Urticaria is hives. So urticaria being hives and then pruritus being itching, those two terms could go together potentially in a provider's findings and their notes. Different blood tests that we do regarding blood. Probably the number one is going to be the complete blood count, the CBC. We draw that probably more than any other test that we would do anywhere, honestly. So the CBC, because that gives us a breakdown of all the different blood elements, white blood cells, red blood cells, the different component parts of blood cells. A CBC is going to give us this overall general picture, oftentimes, of what our immune system is doing. It can also look for, first signs of things like blood cancers, like leukemia. ABO blood typing, sometimes we call that ABO-RH. So that would be A, B, or AB, and O with the rhesus factor, so ABO-RH. Erythrocyte sedimentation rate, or ESR. Sometimes it's called a Westergren or a SED rate. So it could be any of those things. It says it measures the degree of erythrocyte settling that occurs in blood. It is a good, an ESR is a good inflammatory marker for something like rheumatoid arthritis or other arthritic conditions. We oftentimes draw an ESR with that or to look for that and potentially diagnose. Hematocrit measures the number of RBCs in a blood sample, or red blood cells. And then the hemoglobin measures the amount of hemoglobin in a specific volume of blood. And oftentimes we do that together, hematocrit and hemoglobin, or we'll call it an H&H. Okay. Prothrombin time, probably another good one. Prothrombin, PTINR, is used to evaluate clotting factors. If you have a patient who is on blood thinners, we will do PTINRs pretty frequently on those patients in order to make sure that if we're giving them a blood thinner, we're not making their blood too thin where they could possibly bleed to death, or we need to give them more blood thinner because it's still too thick and they could potentially develop clots. And then the rheumatoid factor measures the presence of IgG and IgM. And again, that would be used in arthritis panels. Okay, RH typing. This is the antigen that we look for when we're doing blood type testing. So that ABORH. Okay, we did WBCs. Western blot detects the presence of specific viral proteins. This is a confirmatory test for something like HIV. If we were doing an HIV blood test, serum test, the Western blot is the confirmatory test that's performed at the end of doing the HIV testing. Okay. Bone marrow aspiration or biopsy. This is a good diagnostic test. As with most things, biopsies are probably used for real definitive diagnosis. It's the best method for diagnosing a lot of things because we take a sample of whatever the tissue is, and we have it identified or looked at under the microscope in the lab or used with special equipment in the laboratory to identify things like, cancers, bone marrow cancer. Okay. Patch and scratch allergy tests. If you've ever been to an allergist, you might have done allergy testing to figure out or determine exactly what antigens you're allergic to. There's a couple of different ones we do here. The scratch test introduces allergens into a scratched area on the skin. Probably more common is the intradermal skin test, where we inject a small amount of the of an antigen under the dermis and or into the dermis, and then read the reaction from that. Okay. Let's see, causes of certain disorders of the blood and lymphatic system. Obviously, hereditary disorders, genetic disorders. These are common enough in things like blood clotting factors to have potential genetic disposition to possibly leading to you developing or a patient developing blood clots because of a hereditary issue. So genetics plays a factor. Immune dysfunction, where the immune system doesn't necessarily work correctly. It could over-respond or under-respond, depending. And I like it. I think it says when the body defenses are exaggerated, misdirected, absent, or depressed. So you can be hypersensitive to things. You could be not as sensitive to things. Your immune system can either overreact or underreact. Okay. Let's see. Other causes of disorders. Different types of anemia, like aplastic anemia. Let's see. I can't even say it. Post-hemorrhagic anemia results from acute or chronic blood loss. This could be potentially from having an injury that causes you to lose blood. Could be from ulcers, bleeding ulcers inside the abdomen. Could lead to post-hemorrhagic anemia. Okay. Let's see, what else do we have? Sickle cell anemia, hereditary disease, which is common in the African American population, where the RBCs are abnormally shaped, so they don't function properly. Thalassemia is a hereditary disease, where hemoglobin isn't produced properly. Okay, different blood clotting disorders. We kind of talked about that. Probably the second one, factor V Leiden mutation. It says relatively common inherited mutation in the factor V gene that causes the development of inappropriate blood clots and predisposes younger patients to stroke. So this is probably the most common blood test that I have done in my career looking for hereditary disorders, and probably the most common one that I believe when I was working in the industry, that was the most common one that we would find for somebody having blood clotting disorder would be the deficiency in the factor V. Okay, let's see. Hypersensitivity disorders, okay, may be caused by an exaggerated or inappropriate immune response. Asthma, a chronic restrictive airway disorder, okay. Acute asthma, I like, it says can begin dramatically with severe symptoms or slowly with gradual symptoms, okay. Extrinsic asthma results from a reaction to a sensitizing substance like pollen or mold, okay. Intrinsic asthma, diagnosed with when no extrinsic allergen can be identified, okay. And then status asthmaticus is an intractable asthma attack that can lead to acute respiratory failure or almost, fairly immediate respiratory failure if not acted upon quickly, okay. Different hypersensitivity disorders, things like allergic rhinitis, which causes runny nose, itching, nasal congestion. It's kind of like part of the seasonal allergy process potentially. Anaphylaxis is an acute life-threatening allergic reaction typically with sudden onset and can be life-threatening. Okay, latex allergies, allergic reactions, fairly common, occasionally serious. They can present themselves with hives, chills, possibly fever. Okay. Different autoimmune disorders, rheumatoid arthritis, we've already kind of talked about. Scleroderma, where the connective tissue, for the most part, in the skeletal muscles, internal organs, hardens. The fibrous makeup of these things can harden or change. Okay, Sjogren's syndrome, a rheumatoid disorder marked by decreased secretions from the lacrimal and salivary glands. That's Sjogren's. Lupus, chronic inflammatory disorder, usually affects multiple organs, can be very debilitating. Okay. Let's see, immunodeficiency disorders, things like acquired immunodeficiency disorder or AIDS, human immunodeficiency virus, HIV, where, and it says cells of the immune system, including the T cells, are destroyed. Okay. Different drug therapies as treatments, anticoagulants for controlling blood clotting disorders, okay, to use to thin the blood. Antihistamines, oftentimes used for allergic reactions to things, to reduce the chances of things like hives developing. Okay, there's many different types of drugs. Thrombolytic therapy, intravenous drugs to break clots. Okay. Iron supplements necessary for hemoglobin. Oftentimes we just do that as over-the-counter iron supplements, but we can do that by prescription as well. Okay. Radiation therapy. This would be, in particular, it says radiation of all lymph node areas used to treat things like Hodgkin's disease, possibly. Surgeries, splenectomy we discussed. Thymectomy, the removal of the thymus, transfusions, blood transfusions, bone marrow transplantation. We see this one fairly frequently now, especially for the immunosuppressed patient, where if the bone marrow is not helping to produce and increase our immune response, a bone marrow transplant may be something that's recommended. Okay. Stem cell transplantation, stem cells donated, then later infused for patients, and that also can aid in the immune response. So that's it for Chapter 14, and I look forward to seeing you next time for Chapter 15.